Welcome to the National Organization of Nurse Practitioner Faculty's podcast.
Welcome to the second series of the NONPF podcast, created by the Simulation Committee of NONPF. This year, our podcast series, titled In the Trenches, Confessions and Pearls of NP Simulationists, will center around the 2023 fall release of the NONPF Guide to Nurse Practitioner Simulations, a step-by-step approach. This guide, an e-learning book, was created by the NONPF Simulation Committee. The ebook is formatted to help NP faculty design effective, measurable simulations that address learner programmatic and national level competencies. Led by members of the current Simulation Committee, podcast moderators invite authors of the ebook to share pearls of approaching simulation from the perspective of the nurse practitioner. Welcome to our second NONPF podcast for our ebook. And I would like to welcome our key guest today, Dr. Mary Brennan. I'm Jeannie O'Rourke. I'm one of the co-moderators today. I'm an associate professor at Loyola University in Chicago. And my co-moderator today, I'm excited to welcome her. Queen, do you want to introduce yourself?
I'm Queen Henry. I'm an assistant professor at Vanderbilt University School of Nursing. I'm glad to be here.
Thank you. I'm glad you're here. And Mary, Dr. Brennan, would you like to introduce yourself?
Yes, I'm Mary Brennan. I'm the director of the Adult Gerontology Acute Care Nurse Practitioner Program at New York University, and it's a pleasure to be here today with Jeannie and Queen. Thank you for inviting me.
Thank you. Thank you. And so we are all fortunate that we're members of the NONPF Simulation Committee. And so we have been working together, and this is a great experience for us to sit here and share some of the information that we included in the ebook. So thank you. So the second chapter of the ebook, which is, so the first chapter is the introduction, which you heard about in the first podcast. This podcast is all about conducting a needs assessment, which is really an important first step when you're thinking about where, when, how to implement simulation for a novice all the way to an expert. So my first question for you, Mary, is tell us a little bit about what is a needs assessment, because for some of us, we might not be familiar, and maybe to frame that in light of a needs assessment when you're thinking about simulation rather than the whole curriculum.
Mm-hmm. Well, not much is written about a needs assessment, but both the International Nursing Association for Clinical Simulation and Learning and the NONPF Guide to Simulation both recommend performing a needs assessment, particularly when you're considering developing a program of simulation. There really is not a formal definition of a needs assessment with respect to simulation, but the best definition I found in terms of an overall needs assessment is by Leanne and Gregory, who described the process as a process of assessing the training and educational needs of individuals, groups, or organizations, and aligning their needs with the curriculum. And I think in this respect, it would be aligning the needs with, aligning simulation with the needs of the curriculum. I think overall, a needs assessment just talks about what we need in order to develop and implement a program of simulation.
And in that chapter, you did say that if you're performing a needs analysis, that it will help you to determine the content that needs to be taught and the individuals who need that content. So what are the steps to performing a needs assessment and who should be involved in that process?
Okay, well, thank you, Queen. I think I'll start with answering the second part of that question. I think it's important to consider the perspectives of all the different stakeholders and regulatory bodies. It's important to consider the academic organization's mission, goals, and strategic initiatives. And then conversations and involvement with the deans, the program directors, the faculty, and the financial experts need to be, all of those stakeholders need to be involved when considering developing a simulation program. Obviously, an assessment of the financial resources is so important. You have to consider the space, simulation faculty, mannequins, equipment, and resources to run a simulation lab. And then secondly, what are the steps needed for conducting a needs assessment? Well, initially, I think you do have to look at the organizations, the accrediting organizations, the nursing professional organizations, and the regulatory organizations. Though all of that information needs to be considered in the needs assessment. Secondly, I think reviewing the organization's strengths, weaknesses, opportunities, and threats need to be considered. Next, I think information that we obtain from all of our certification exams, our outcome data, the data that we have about the clinical experiences for students, and any kind of safety data may actually dictate the type of simulation learning that we implement for students. And lastly, I think we need to take into consideration the students' level of knowledge, their skills and attitudes, and their behaviors as they progress through the different programs. So I would say overall, the needs assessment is a multifaceted assessment of what we currently have and what we would like to do in the future with respect to simulation.
I'll build off that. That's great. So, rather than thinking of the needs assessment as something you have to do when you're getting started, because there's probably not a lot of programs at this point that haven't started using simulation, but so we're probably kind of many of us are probably in the middle. So we've gotten started, and we're in the weeds, but we're not in as deep as we want to go. So can you share a little bit about how a program that's kind of maybe in that middle space, right? You've gotten started, but you're not sure if it's really where you want to go. How can you use the needs assessment at that point?
Well, I think this is a particularly important time to consider simulation for programs, particularly with the recent publication of the essentials that were developed by the American Association for the Colleges of Nursing. And what they have developed is really a new educational framework, detailing what the core competencies are that are expected for professional nursing education to prepare our future nursing workforce. Competencies are what really the learner is able to do. And I think simulation is an ideal way to demonstrate what students know and to synthesize their knowledge, values, and skills of their professional nursing identities. I think this is an important time for experienced faculty in simulation and also for those who are interested in developing their programs. The American Association of Colleges of Nursing actually recommended simulation for those competencies that may pose a risk to patients or situations and where there is a limited exposure for students to learn. And they recommend that these are ideal opportunities for simulation. I think about the students in my program who have to develop expertise and competencies in placing lines and intubating patients. And I think simulation provides a very important way for helping those students to practice these skills in a safe way.
What's maybe one or two kind of pearls that you would recommend to someone so they don't feel overwhelmed? Because I know from having done this myself, it can be very overwhelming. All of the pieces of information that you really need to pull in to do to justify and or to do it well. So can you, for someone that's out there thinking, I want to do this, but I'm not really sure how to even get started, give them some advice so they don't feel overwhelmed?
Well, I think using a template or a checklist might be a great way to start a needs assessment. I think there are not many published tools at this point, but each organization could create their own template and then conduct a needs assessment accordingly. I also think with the publication of the new essentials that most organizations are looking at their current outcomes and trying to curricular map in an effort to determine what we're doing correctly at this point, and then how to springboard to the next level of competencies as endorsed by the essentials. And so I think the curricular mapping process is a very complicated one. It can take time, but I think it's very important. I think organizations maybe could develop a project champion to spearhead this initiative. And that might help in gaining momentum for this very important process of curricular mapping.
Great tip. Yeah.
I really like how you talked about programs starting where they are
Yes.
with the resources that they have available. Can you speak to programs? Because sometimes people are carrying out some kind of simulation activity, but not knowing that that's what they're doing. So can you speak to high fidelity and low fidelity simulations and how those can also help to advance the program?
Sure. And I did want to speak to the process of curricular mapping and having all faculty understand that the current process is the best of what we knew how to do at that point. And we are going forward, we are being, our curricular are going to be informed by the latest professional standards and essentials, according to the American Association of the Colleges of Nursing. And we're also going to look at the NONPF role competencies and the specific population competencies, as well as the National Task Force criteria. So that's a lot of mapping to do. But our current curriculum represents our best work so far. And I think going forward, the mapping process will help us to determine not only our best work, but where the gaps are and where we can align our curriculum with those essentials and identify, I'd say, gaps, but more importantly, opportunities for improving the educational experience for our students. I think, different schools have different financial resources. And I think for those schools that don't have a lot of financial resources for high fidelity programs, I think ingenuity and creativity go a long way. You don't have to have a mannequin in order to implement a program of simulation. You can actually implement a program of simulation with role playing in the classroom or case studies, problem-based learning. There are lots of opportunities for students using those innovative strategies to demonstrate what they are learning and demonstrating their competencies. So I think going forward, every school could adopt simulation on some level. And even those organizations who do not have a lot of resources to implement, a large program.
Yeah, I think that's important, though, that the people don't get so overwhelmed and worry as much about what they have and what they don't have technology-wise. It's really about meeting the students where they are, meeting those competencies. And I'll just put a plug in for collaborating, right? There's so many nursing programs out there, and we could have a better sharing of resources to train our students, again, where they're at. And so as part of our work on the NOF Simulation Committee, I think that's one of our goals, right, is to disseminate information and collaborate and to provide resources for those at any stage along their simulation journey. So I appreciate today and being able to just talk about one more way that we can support faculty in understanding how to determine, again, the needs of their simulation program specifically, and that journey. So thanks so much, Mary, for joining us today. Appreciate your time. It's been an engaging conversation. Thank you so much, Queen. And I've really enjoyed it. And we'll see you next time.
Well, thank you, Jenny, and thank you, Queen. It was a pleasure to be here.
Same here. Thank you so much.
Thank you.
Thank you for joining us today to hear from our NOF simulation experts. This podcast has been written, directed, and produced by David House, Jenny O'Rourke, Elaine Kauschinger, Tedra Smith, Jeannie Rodriguez, Leanne Barfield, and Queen Henry-Okafor. Special thanks to NOF CEO Mary Beth Bigley. The digital ebook is available for purchase on the NOF website to both members and non-members. The opinions expressed in this podcast series or any product mentioned are not specifically endorsed by NOF.